All right, welcome everyone. I'm Sophie Alexander from the Nutritional Wellness Center in Ithaca, New York, and eager to share with you today how to optimize your heart health. Let me get my PowerPoint moving along. Today, we're going to be just talking about ways to support heart healthy habits and lifestyle options, and really talking about a lot of things that are for immediate health support and long-term health and wellness. We're going to be really working to disrupt some patterns, some normal thoughts and preconceived ideas, and really addressing root cause ways to support the heart and root cause issues about why things might not be going optimally. Of course, I just put my disclaimer in here, and then we'll move on. Okay. So heart disease is the #1 cause of death in the United States, right? It's leading cause of death for men, women, and most different racial and ethnic groups. These statistics are pretty depressing. A person dies every 36 seconds in the United States from cardiovascular disease. So it contributes to 1 in every 4 deaths. So understandably, it's something that we all have a lot of attention on. We want to work to prevent and want to understand. But I would say that because it's such a dominant issue, there's a lot of misunderstoods. And so, yeah, we have the C word, right? In our modern world, cholesterol has become almost a swear word. And that cholesterol is thought of as being evil and needs to be fought off and is the cause of heart disease. And I really want to start just correcting these misunderstoods, because cholesterol is not the bad guy, right? Our bodies are made out of billions of cells, and almost every cell produces cholesterol all the time during all of our lives. And why is this? Because every cell of every organ has cholesterol as part of its structure. So cholesterol is an integral and very important part of our cell membranes. And it's also just a big part of what makes up our brains as well. So cholesterol is a waxy fat-like substance. It's found in all the cells of our body. Our body needs some cholesterol to make our hormones, our vitamin D, and helps us to digest foods. And our body makes all the cholesterol that it needs. And so cholesterol is considered a nutrient. So unlike fat, protein, and carbohydrates, cholesterol cannot be used for energy, but it's a vital structural and functional component of our body's metabolism. And I have listed at the top the optimal range in blood labs, right? So that's 180 to 220. Again, that still could be debated as controversial because cholesterol numbers just over history have just been being brought down lower and lower. It used to be, thought that 300 was fine, right? Now I see some doctors saying, well, just the lower, the better. But of course, the more we learn, the more we know. But I really see that numbers in the 200s are fine, depending, again, on some other factors, some other ratios as well. And that if it goes too low, that it's really a problem, right? It's a problem because we talked about how cholesterol makes hormones. So it's an issue with fertility for women if their cholesterol is too low. I mentioned how cholesterol makes up a lot of the brain. Well, we see connections with Alzheimer's and dementia if cholesterol is too low. So when cholesterol is too high, can see it linked to issues with the thyroid, so the thyroid being hypo can contribute to high cholesterol. And there's a lot of it tied into how the body is handling sugar. So there can be insulin resistance, type 2 diabetes, metabolic syndrome, hypertension, stress response of the body. Are all reasons why cholesterol can be high. And I would add to that list too, that just general liver stress as well. I list liver dysfunction under just decreased values as well, but I have found if the body is dealing with a toxicity or the body's dealing with something that's creating systemic inflammation, cholesterol levels would be high. There'll be a higher output and production of cholesterol from the liver as the body is using that cholesterol to repair itself. Decreased values of cholesterol can be because the thyroid is hyperactive. It can be an indicator of autoimmune disorders, malnutrition, not absorbing fats properly, and poor pancreas and liver dysfunction. I would say in general, though, most people are dealing with the increased values and really trying to figure out ways to help their body optimize those increased values, because we're trying to avoid, you know, the push for medications such as statins to lower cholesterol, right? We're wanting to really understand what's out of balance in the body, what is causing these numbers to be high. So I really want to educate you about cholesterol. I want you to start to like appreciate and love cholesterol, because cholesterol is one of the raw materials used by the body to heal wounds. So this means cholesterol will be found in areas such as arteries where damage has already occurred. And this is a subject that I care a lot about. It was actually my master's degree thesis. I wrote about why we get that initial damage in the arteries. And I was studying and looking at research topics all about atherosclerosis and sugar's role with it. So I think sugar, I'll back up and say cholesterol gets blamed for what sugar did. And so in many situations, especially when it comes to heart health and arterial health. So if the damage is already there from the processed foods, such as refined sugar, white flours and grains, then if there's damage in the artery, there's a weakening of the artery. Cholesterol is used by the body to repair that damage, to strengthen it, to fortify the area. But what can happen is if there's a weakened area of the artery, the cholesterol gets slapped on there on the side to strengthen it. But then that weakening just works further down the artery, right? Because there's not the overall strengthening of the artery happening. Potentially the damaging foods, the high sugar in the blood, things like that are continuing to happen. Then the body will just continue to put more and more cholesterol there, trying to just further lengthen that. Then that blockage becomes bigger and it starts to obstruct more and more. So I often use the analogy when talking with clients that cholesterol is the fireman at the fire. So we don't want to blame the fireman for the fire. We want to understand what's causing the fire, and then the fireman won't need to be there. Some other fun facts about cholesterol. Cholesterol is a precursor to steroid hormones. This means that for your adrenal glands to produce enough stress hormones, such as cortisol, and for your body to make enough of the sex hormones like estrogen, testosterone, and progesterone, you must have enough cholesterol available. And this is a problem I see people run into, especially if they're on medications to really push the cholesterol lower. It starts impacting these other areas of the body. So your wonderfully intelligent body regulates your cholesterol levels. You manufacture the cholesterol in your liver to use along with your dietary cholesterol. As your consumption of dietary cholesterol increases, your liver reduces its production of cholesterol. And that's where I have seen with clients who have higher levels of cholesterol, they're worried about it. They're trying to figure out how to bring it down. And so if they're doing the kind of traditional doctor recommended approach of like cutting out saturated fats out of their diet, cutting out eggs, cutting out red meat, like things like that, I have seen situations where the total cholesterol levels didn't change, even if they're in the 300s. And that's because, the body compensated. You're getting maybe less in through your diet, but the body's still going to be making as much as it perceives that it needs to address what's going on in the body. So I actually see more success reducing a cholesterol if we support the liver well, we support the thyroid properly, we support the strengthening of the arterial walls, and so the body stops being like, oh, I need to make more cholesterol for all these different imbalances. But I'm getting ahead of myself. So the reverse is also true. The body requires dietary cholesterol intake because your body cannot form all the cholesterol needed to meet its metabolic demands. So the majority of your cholesterol is made by your body, is already in your body, but we do need to still consume it to support what our bodies need. And in general, I think there's just been so much back and forth in the nutrition field and the health field about cholesterol. But at this point, eggs are no longer being vilified and told you should limit how many you eat because of cholesterol. We're really recognizing all the important nutritional value that's in the egg and the good proteins and the good fats there. So let me dive into a little bit more of the specifics about cholesterol. So there's HDL component of your cholesterol is called the high density lipoprotein. This is also often called the good cholesterol. So it's one of the classes of lipoproteins that carry cholesterol in the blood. HDLs consist primarily of protein with a small amount of cholesterol. It's beneficial because it removes excess cholesterol from tissues and carries it to the liver for disposal or recycling. So it's named good because it's bringing things back. It's bringing stuff back to the liver. It's not what's getting sent out into the body. So when it's increased, like it's higher than the optimal levels for men and women, this can be a sign of toxicity in the body. This can be a sign of autoimmunity, can be a sign of excess inflammation, and it can be a sign of osteoporosis. If it's too low, it can be tied to things like lack of exercise, obesity, metabolic syndrome, and diabetes. Or I'll add to that too, someone who's really just not getting enough good quality fat, like good quality cholesterol in their diet. They're avoiding it for certain reasons. The triglycerides, the optimal range is 40 to 50% of total cholesterol. If you want another set of numbers, I really like seeing triglycerides between 80 to 100. When I see that, I see that the person, it really reflects to me that that person's not eating a lot of sugar in their diet. Triglycerides are circulating lipids made in the liver. These are blood fats that are a source of energy production, and they're made up of 3 fatty acids attached into a glycerol molecule, hence they're called triglycerides. How your liver's doing, your thyroid and your pancreas can affect triglyceride levels. It's a source of stored energy in the body. So when triglycerides are in excess in the blood, they are deposited as fat. So just saying, when you're measuring your blood, recent ingestion of fatty meals may show elevated triglycerides. I do definitely use this as a marker to see how the body's handling sugar. And yeah, whether or not it's handling it well. So when triglycerides are increased, it's a sign of insulin resistance, metabolic syndrome, type 2 diabetes. Again, we got the thyroid being low. Atherosclerosis can be tied into oral contraceptive use, can reflect hepatitis, a high carbohydrate diet, someone who's not fasting and really would benefit from that, or someone who's is eating too much caloric excess. When triglyceride values are too low, it can be a sign of a hyperthyroid, an autoimmune disorder, a vegetarian diet, malnutrition, fat malabsorption, and poor pancreas and liver function. Then we got the LDL, the low density lipoproteins, also known as the bad cholesterol, fortunately. So LDLs they transport cholesterol, fatty acids, and fat-soluble nutrients from the liver to other tissues. So it's known as the bad cholesterol because it is thought that this process increases the risk of atherosclerosis, the buildup of fats, cholesterol, and other substances in and on the artery walls. So as LDLs increase, HDLs generally decrease. And so hence there's also this association in the diagnosis of atherosclerosis. But LDL is a vital marker since it's how the body can obtain and use cholesterol to manufacture hormones, help manage stress, keep the brain healthy, metabolize vitamin D. And so it's mostly the most common marker to why people are put on statins and why people are diagnosed with high cholesterol. And it's definitely been shown that statins reduce LDLs, but it's not necessarily been shown that statins then reduce heart disease. And the question is just, what is this marker actually telling us in terms of what's the incorrect processes going on in the body? And I just argue it's much broader. When cholesterol levels go up, we have to wonder why the body needs more cholesterol and why these LDLs are being recruited. When LDLs are high, yes, it can be an indicator of cholesterol buildup in the arteries, but it also can be an indicator that the thyroid is hypo, that there's insulin resistance, there's type 2 diabetes, there's metabolic syndrome, there's hypertension, or the big one that there's stress, right? You remember I said that we need cholesterol to make cortisol. Well, in this day and age, like so many people have high levels of cortisol chronically, and that is a really big part of why their bodies are out of balance, and why there's more inflammation. It could be tied back to why they have more LDLs. If the LDLs are very low for someone, it can be that the thyroid is hyper. Again, you can see a pattern here: autoimmune, vegetarian diets, malnutrition, malabsorption of fats, and poor pancreas and liver function. So a great read, a must read, I would say, is The Great Cholesterol Con: The Truth About What Really Causes Heart Disease and How to Avoid It by Malcolm Kendrick. And it goes into a lot of these things that I've talked about, but in further detail. And I think if you're someone who's dealing with your cholesterol having a higher marker, having a doctor either already on statins or really encouraging you to take statins, and you're not already approaching some of these other underlying causes that I'm talking about, this is another way to really help yourself understand and get to the bottom of it. Now I want to start talking into what damages the heart, and again, what can damage the arteries in connection with the heart, and what can contribute to some of these patterns that I've been talking about. So it can be damaged by refined sugars such as corn syrup, refined carbohydrates, about particularly white flours, trans fats, and what we label as bad fats in general: canola oil, safflower oils, sunflower oils, soy oil, peanut oil. They're incredibly inflammatory for our body and actually take us more time to break down than it does take our body to break down sugar. They stay in the body for longer. There's a lot of different immune challenges that affect the heart. We're talking about, it can be more chronic immune challenges, like we're talking now in the age of long COVID and COVID in general. I also mean by immune challenges, I mean stealth pathogens such as Lyme spirochetes. Heavy metals and chemical toxicities can play a big role in why the body is inflamed or dealing with tissue damage that needs cholesterol to repair. There's a whole factor of mold exposure, which I'll talk about a little bit more in a moment. Not getting enough sleep. Again, that creates a very imbalanced stress response in the body, higher cortisol, and more inflammation. And then dental problems. That's a whole other talk, but there's a huge just link between what's going on in your mouth, whether you have metal amalgam fillings or whether you have chronic infections there, and all the meridians in the body, and how those teeth can then correlate to areas such as the heart and contribute to damage. So mold. Mold toxicity definitely can affect your heart. Mold toxicity is one of the least understood health issues today. And unfortunately, it's also something that many doctors miss, especially when diagnosed with an irregular heartbeat. This is something that's my own personal health story. I've had Lyme for the past almost 20 years, but I've also had a history of living in a really moldy space, and just out of the blue got diagnosed with an irregular heartbeat. The cardiologists, they monitor me. They don't know what's causing it, right? But it's so interesting through my work with the nutrition response testing to really see, the mold and the Lyme, and when those things are flared up with me, I can really feel the irregularity with my heart. And when those things are under control and are being handled, I don't notice it at all. Mold allergies can cause an acute allergic reaction, but we're really talking more about prolonged exposure. So mold can cause heart problems, including myocarditis, inflammation of the heart muscle, and endocarditis, and infection of the lining of the heart. And I think what a lot of people don't realize is within 48 hours of dampness or like a water leak, water damage, that mold pathogens begin to grow. And the wonderful thing is it absolutely can be cleaned out. It's of your body. It's a long-term process, but you have to make sure that you're not continually living in it. You don't actually have to smell it to have there be mycotoxins that you are being exposed to on a regular basis. A bad diet can lead to unbalanced cholesterol. So I don't think how many people realize that how much sugar affects heart function. The most significant source of abnormal cholesterol is not fat at all, it's sugar. So the sugar you consume converts to fats in your body, and the worst culprit of all is high fructose corn syrup. So consumption of high fructose corn syrup, sodas, juices, processed foods, just sugar in general, is a primary nutritional cause of most cholesterol issues, just in terms of the amount of fat in people's blood, and then the damage that's causing to the arteries, and the cholesterol being there to repair it. So a huge thing we can do for protecting the heart is avoiding sugar. So some general cliff notes. Cholesterol is not the cause of heart disease. It's not the bad guy. Cholesterol is not the cause of hardening of arteries. High cholesterol is not caused by eating foods high in cholesterol. Toxic mold exposure affects heart health. Cholesterol is needed by every cell in the body, but your diet for sure can contribute to unbalanced cholesterol. And that's one of the places most people start. And if that's a place where you've already been working, right, and you've already reduced the sugar tremendously in your diet, you're seeing the cholesterol or the triglyceride numbers particularly improve, but the LDLs are not improving, right, or even worsening. I would say that that's really the time to be looking at some of these other issues that I talked about, looking at the thyroid, looking at dental health, looking at toxicity issues such as mold, heavy metals, other chemicals. All right, so a little fun quiz here for you all. And but bear with me, just checking the chat if I can make it work. Oh, computer. I'm sorry, my chat just did something weird, but I will go back and check it in a moment. Let me get into my quiz. So, which option do you think will raise the LDL, low density lipoprotein, sometimes called bad cholesterol, the most, right? Is it going to be option A or option B? So most people would think it was option B, but the winner is actually option A, right? This is what we consider a high carbohydrate breakfast between the grains in the bread, the sugar and the fruit in the spreads, and that will raise LDLs. Let me check my chat again, see if I can get it to bring it up. Okay, so Beth was asking how long does it take after reducing sugar to see a change in the cholesterol numbers? Yeah. I mean, I have seen gosh, I've seen cholesterol numbers improve within 3 weeks, actually, because I have clients do sometimes a concentrated purification called the standard process purification program. It's 3 weeks where people rapidly change around their diets, pulling out all refined sugars, all refined grains, and doing some supplements that also help support liver function and detoxification. And we've seen dramatic improvements in cholesterol numbers within those 3 weeks. In general, I tell people, give your body at least 3 months to correct and reset lab numbers. And so gluten-free carbohydrates, this is another great question from Beth. Absolutely, gluten-free carbohydrates will raise LDLs. There's a lot of movement of people away from wheat, recognizing that how much wheat causes inflammation, and switching over to a gluten-free diet. And while that's a better option because of the avoidance of the wheat and potentially the pesticides that are in the wheat, there are a lot of junky gluten-free options out there, right? They're made with cornstarch or tapioca flour, other things that are quick carbohydrates to the body, do spike blood sugar quickly, and can contribute to the same imbalances I was just talking about. So you're going to eat more gluten-free. If you want to eat more gluten-free, that you're wanting to actually have the whole grain, right? It's better to eat like actual rice than it is to eat rice bread, that more refined carbohydrate. So yeah, in general, I find that it's really important that people, and I'm going to talk about this more in just a minute, just about diet. So I think some of your questions that are coming up now, I'm going to answer, and then I'll circle back to them if I don't. But in general, it's reducing. The step number one is removing refined sugars and grains. And then for certain individuals, we have to start looking at just how much sugar in general, meaning like sugars coming from fruit as well and things like that. But not everybody needs to be really careful, say, about whether they eat bananas compared to berries, right? And the sugar content of the fruit. Some people do, but it's the first step is how does the body respond to getting out refined sugars and grains? Yeah, so diet just plays such a significant role in heart health. And you just have to have a proper nutritional balance to support the correct rate, rhythm, and tone for our heart. And so a lot of the things that are, known as more healthy foods, right? Whether it's your leafy greens, your berries, your healthy fats and avocados and fatty fish oils, nuts, garlic, olive oil, right? These are all things that do nourish the heart. And it's important to focus on the things that we can eat versus the things that we should avoid. But the heart really runs on B vitamins. It supports them tremendously. And B vitamins can be low in people if they're avoiding eggs and if they're avoiding red meat. Red meat is one of our best sources of B vitamins. And so red meat is then is a heart supportive food. B vitamins help us convert carbohydrates to glucose. They help us improve our fat, protein, and amino acid metabolism. They normalize nerve function. They support us with our energy production and our stress handling. They relax the nervous system and bring energy to our majority of our body systems. So B vitamins support our skin, hair, eyes, our liver, which does so many processes. They support the mucus lining all the way from our mouth through our anus. They support muscle tone in our GI tract and in the heart muscle specifically. So I do love Cardio Plus as a heart support product with a lot of wonderful B's in it from Standard Process. It supports the heart and cardiovascular function. It supports the functioning of all the muscles in the body, really, but it does specifically support the heart, supports healthy circulation, provides the body with antioxidant activity, supports the energy metabolism. And it's just such a great source of these different B's as well as C. So that's a favorite of mine, especially if people are dealing with high blood pressure as well. And then there's another great supplement, Cataplex B Core, contains a lot of liver, which is also a wonderful source of Bs. And I just use this a lot for cellular energy support for when people don't want to eat liver, but we're really working to give them that B vitamin support. Keep checking the chat here to make sure I'm getting your questions. All right, just because I was just talking about foods a minute ago, I want to answer your question, Cindy. But what are the better grains to eat? The better grains to eat are the more unusual grains, and meaning things that are just not so commonly used, and the ones that are more considered pseudo grains, like they're more grass-like. So that's buckwheat, that's wild rice, that's quinoa. You know, yeah, because some forms of rice are fine, you know, especially rices if you can get them from India. They're known to have less arsenic in them. But in general, I encourage people to minimize their grain intake overall and stick to those pseudo grains. And then yes, absolutely, butter is still okay. Butter is one of those healthy fats. It is a source of dietary cholesterol, but again, as we just went over, it's not going to, you know, you're not going to eat butter and that's going to end up in your artery, right? There's all these other processes about why the body might be creating cholesterol that's ending up in the arteries, and is a wonderful source of fat soluble vitamins. And you, Cindy, also had a question, right, about if the HDLs are really high, right? So we talked about the optimal range of HDLs being in the 60s. And if HDL is really high, like above 100, it's not necessarily a bad thing per se. It's just a question, right? Why is the body bringing so much HDL back to be recycled? Is that because it's not, you know, what's causing an imbalance in that regulation of the HDLs? And I can't remember the exact details I said a couple slides back, but for sure the really high HDLs is an indicator of several imbalances, typically with the thyroid or the immune system. All right. So I want to share some other tools we use at the office to assess the heart. We use a heart rate variability test. And it's a test that's evaluating the body's vital functions. It's a heart monitor that you wear that's measuring all the variations in the heartbeat. And it really does, really through the variations in the heart, gives us feedback about how the body's healing and repairing itself, how it's responding to stress, how's the overall functioning of organ systems, how's your autonomic nervous system functioning, meaning your fight or flight response versus your rest and repair response. It can give us information if whether you're chronically in fight or flight, which is a real issue with then cortisol dominance. And it can just and can also reflect how are you doing in terms of achieving physical fitness as well. And so we use this to you know, look at big picture patterns, and I think and understand how is the body in terms, how is it healing and repairing itself, and how is it improving function, or is there something continuing to cause stress in the system? And then I use a technique called nutrition response testing, also known as muscle testing, that is really my primary tool for getting to these underlying causes, right? I use this to identify and look for the issues I mentioned, such as hormone imbalance, such as high cortisol, mold toxicity, heavy metal toxicity, chemical sensitivities, overall how's the liver functioning and draining, and how is bile flow, and how is the body diet, well, is the body breaking down fats, all these types of questions we can use by using this very non-invasive method of asking the body a lot of questions. We also educate and coach people on diet. So we have Ryan Kimball as a health coach. I also, besides myself as a practitioner, there's Fabiola Reyes as a practitioner and as a nutritional consultant. And so we have several different types of programs where we either just do one-on-one nutritional coaching, healthy weight loss program, and then also our muscle testing program that incorporates the nutritional coaching as well. And we just really do no size, one size fits all type of program. You know, each person is approached as an individual. And while there are overall themes that we are educating people about, right? How to reduce your sugars, how to reduce your grains, identifying what imbalances are happening in the body. I really strongly believe that nobody needs to eat identically as anybody else, right? Like there's all these individualities about it. Some other tools we use to support detoxification in the office, because I do see that this is such a huge reason why people are struggling with imbalances with their cholesterol numbers or struggling with their heart health, is the just ever increasing rise in toxicities exposure. I've been doing this work. I've been in practice for 12 years, and just the it feels like every year it's like there's people are struggling with more toxin load, and it's getting trickier to help people to clear them out. It used to be, well, just avoid them in your food and avoid them in your water, and take some targeted supplement support, and you're good. And now we're finding that there's some of these lifestyle steps, like doing the ion cleanse detox foot bath, where you sit with your feet in water and with the ions that are put into the water through the little device you can see there sitting in the water right near Bonnie's toes, it helps to pull the toxicities through your feet out into the water. And it's pretty wild. Like the water goes from that orangey color there to it turns black and green and gets white foam, just depending on the individual and what meridians are being pulled and what is clearing out. And what I love with this device is it facilitates detoxification overall. So it's not just the action of sitting in the bath, but it's a foot bath. It supports and facilitates ongoing detoxification. So I've added this into the practice over the past few years, and I've seen that really accelerate for people or help for people where the toxins are really locked into certain tissues, helping us to access them better and move them out. Also, for several years, we've had a PEMF mat at the office. It's pulsed electromagnetic therapy. There's a large amount of EMF pollution that surrounds all of us. And that's coming from our computers, our phones, the cell towers, just all the electricity that we're surrounded by. And I find that for certain individuals, this is a real contribute of their cellular stress. So PEMF therapy is like a 30-minute nap. It's super relaxing. You lie on it, and there's different settings that we use to address which areas we want to target of the body. In general, it's more about like what you benefit from it, right? We see decreased pain. We see increased microcirculation. We see a reduction of stress in the body and improved sleep patterns, faster healing of soft tissue, reduced inflammation and swelling. I think one of our most dramatic stories was from a Cornell student who had torn his quad and came and used it every day for a few weeks. Well, that was every day that we were open, and he was just back on the field so much faster, and his doctors were really impressed by how quickly he had healed. It accelerates nerve degeneration. I have a client with neuropathy who bought her own mat after using it so many times because she was seeing such an improvement in that symptom. Improves overall immune response. And so this is a tool that we really use to boost the mitochondria, to get the cellular energy up so that the body can be healing and repairing faster. Because that's one of the problems I'm seeing, just as at the increased toxic load, the cells are just more and more tired. And so it's taking more support to get the cells working properly again. And then we also have an infrared sauna with red light therapy in it. And saunas have been used for so many years to improve all aspects of health. I love this as a tool for relaxation, a tool for boosting the immune system, reducing inflammation, of course, clearing the body of heavy metals and chemical toxicities, um, yeah, supporting your mood and overall relaxation, reducing pain, and opening up what I call the drainage pathways of the body. So that's the lymph, that's the liver, and that's the kidneys, and just facilitating the body with its detoxification process. Gosh, so I hope you learned a lot today. I hope it really helped you to rethink and reframe how you think about heart health and how you think about cholesterol. Um, if this is something you've been doing for a long time, I hope it gave you some ideas of other avenues to think about or to start working on or to dig into more. And if this is something that you have not even begun to approach, I encourage you to start your health journey today and reach out to us at the Nutritional Wellness Center, so that we can be there with you every step of the way.
Thank you, Sophie. That was great.
Oh, you're so welcome.